NUR 355 Exam 3 Newest 2026-2027 Actual Exam Preparation with complete questions and correct answers with rationales. Question 1. A male client is admitted unresponsive to the emergency department following a MV. EMT report patient was ejected 25 feet from vehicle. BP 100/54. HR 110 Rural Route 12. What is the first priority of care? Maintain a patient airway and cervical spine precautions. Question 2. The nurse is caring for a client who had a knee amputation 2 days ago. The residual limb was wrapped with an elastic compression bandage, which has come off. The nurse immediately rewraps the stump with an elastic compression bandage. Rewraps the stump with an elastic compression bandage. Question 3. The patient presents to the ER having a chemical burn to the eye. While at work, the nurse would anticipate that the emergency treatment for this eye injury would be to flush the IW large amounts of water or normal saline. Flush the IW large amounts of water or normal saline. Question 4. All costs associated with organ procurement are paid for by. Select all. Private funding, insurance, government, reimbursement. Private funding, insurance, government, reimbursement. Question 5. The nurse caring for a patient who developed diabetes insipidus from a traumatic brain injury would expect to administer which medication? Desmopressin, DVAP. Desmopressin, DVAP. Question 6. Mr. H has a closed head injury and responds to painful stimuli by extending both upper and lower extremities, outward rotating both upper extremities and plantar flexion of both feet. The nurse would correctly demonstrate this as decerebrate posturing. Decerebrate posturing. Question 7. First-person consent has been enacted in some states. First-person consent makes an individual's decision to be an organ donor legally binding. Makes an individual's decision to be an organ donor legally binding. Question 8. The patient with cerebral edema has a decreased cerebral perfusion pressure less than 60 mm Hg. Which of the following nursing interventions would be most effective in correcting the patient's CPP? Maintaining a BP 90/50ths. Maintaining a BP 90/50ths. Question 9. The patient has N4 of 500 ml 0.45 Ns with 20 ml equivalent of potassium chloride infusion 100 cubic centimeters per hour. How many μ of potassium is the patient receiving per hour? 4 ml equivalent potassium/HR. 4 ml equivalent potassium/HR. Question 10. The patient sustains a gunshot wound to the chest and arrives at the ER hypotensive BP 70/50ths, HR 150, sinus tach, unresponsive, and is hemorrhaging. He requires intubation and mechanical ventilation. The nurse would anticipate infusing O-neg RBC. O-neg RBC. Question 11. A patient with a Lafort 2 injury has clear nasal drainage and bloody otorrhea. The most appropriate nursing action would be 2. Assess the drainage for presence of glucose. Assess the drainage for presence of glucose. Question 12. The nurse is caring for a patient during a seizure. What are the priority nursing assessments/interventions currently? Select all that apply. Maintain patient airway, timing the duration of the seizure, maintain patient safety. Maintain patient airway, timing the duration of the seizure, maintain patient safety.